Welcome, everyone. My thesis title is Treatment-Related Cardiotoxicity in Pediatric Oncology. My name is Nóra Beke. I'm a PhD student, and my mission is that encourage the attitude that clinical practice and research are inseparable. And my vision is that cancer patients should have good life quality without any heart complications. My first project title is Comparing the Diagnostic Tools Accuracy for Early Detection of Cardiac Failure in Pediatric Oncology. And my second project title is Investigating the Side Effects of Tyrosine Kinase Inhibitor in Pediatric Cancer Patients. My first project will be a systematic review and meta-analysis. Although the 5-year overall survival of children with cancer is 80%, cardiovascular diseases are the leading cause of late mortality and morbidity because of the serious cardiotoxic side effects of the treatment. Childhood cancer survivors have 5 to 15 increased risk for heart failure, and almost half of the patients have myocardial injury. Current guidelines suggest echocardiography for monitoring, but in many cases it does not detect early enough. Otherwise, we know several other screening modalities, for example, other imaging techniques, blood biomarkers, genetic variants, and omics technology. However, so far, there is no study that compares their accuracy. Therefore, our aim is to find out which is the earliest and the most accurate prognostic tool in detection of cardiotoxicity, and if we succeed, we can make a recommendation for which tool should be used in order to minimize cardiotoxic side effects. It's a very important topic because early detection allows us immediate intervention so we can save lives. Our clinical question is, what is the most accurate prognostic tool for predicting therapy-related cardiotoxicity in childhood cancer patients? We will use PFO framework. The population is children with cancer. The prognostic factors is cardiac biomarkers, echo, genetic variants, and microRNA, and the outcome will be the prediction accuracy of heart failure. Our hypothesis is that echocardiography is the most accurate prognostic tool in prediction of therapy-related cardiotoxicity in childhood cancer patients. Our study clinical implication is that with the most accurate tool, we could give better disease outcome for the patients, less unnecessary tests need to be performed. The clinicians could follow appropriate recommendation during the treatment, and in addition to all, it could be a good starting point for developing even more accurate tools. My search case contains 4 domains: pediatric cancer, accuracy, and cardiotoxicity. My first key article is about global longitudinal strain, which is an echocardiographic parameter, and the conclusion of the study that decline in GLS during the treatment is predicted cardiotoxicity. My second key article also about global longitudinal strain, and they found that global longitudinal strain is a promising prognostic factor for predicting cardiotoxicity. My third key article, the investigated factor was troponin T and microRNA, and they found that both of them increase parallel with decrease in global longitudinal strain. And my last key article also about circulating microRNA, and the conclusion of the study that microRNA elevated after the treatment parallel with increased dose and other cardiac biomarkers. After the systematic search, I have 5,000 articles. After the duplicate removal, 4,000 articles. And after the title abstract selection, I have 177 articles. Currently, I'm in the full text selection phase. My second project will be a systematic review and meta-analysis. The most promising groups in targeted therapy are tyrosine kinase inhibitor. These drugs work by blocking these tyrosine kinase enzymes, so they affect gene transcription and DNA synthesis. The patients often receive them for years. That's why very important to know what their long-term side effect profile. The major groups of side effects, what they can cause, are cardiotoxicity, hepatotoxicity, endocrinopathy, and growth retardation. But so far, there is no comprehensive study about these effects. We plan to use 3, 5, and 10 years follow-up period during the study. Our study aim is to provide evidence of what side effects can be expected in the long term. Our clinical question is, what are the long-term side effects of tyrosine kinase inhibitor in pediatric oncology? We use PICO framework. The population is pediatric cancer patients. The intervention group is chemotherapy with tyrosine kinase inhibitor. The control group is chemotherapy without tyrosine kinase inhibitor. And the outcome will be the side effects. Our hypothesis is the use of tyrosine kinase inhibitor during chemotherapy does not increase the risk for hepatotoxicity, cardiotoxicity, endocrinopathy, and growth retardation in pediatric cancer patients. Our clinical research, our clinical implication is that give better disease outcome for the patients, provide evidence regarding its long-term effect, and the clinicians could make prevention in time. My preliminary research case contains 3 domains: pediatric cancer and tyrosine kinase inhibitor. And since my vision is that pediatric oncology patients should live high-quality life without complication, I would like to support this with my 2 studies. And thank you for your attention. I would like to end my presentation with the words of 19th century writer Ralph Waldo Emerson: all is a riddle, and Cato riddle is another riddle. Thank you.
My question is, how are you planning to measure cardiotoxicity if it's present after chemotherapy?
We define cardiotoxicity based on a decrease in left ventricular ejection fraction.
Thank you.
Do you know what is the frequency, this cardiotoxicity among our patients, for example, in the Semmelweis University?
I don't know current number, but it's very common side effects during our patients.
And your plan only doing the meta-analysis?
Yes.
We saw this.
Yes.
Later, dealing with the patients.
Yes.
Are you planning to do a subgroup analysis on the different chemotherapies or on the different cancer types?
No, because most of the articles don't mention these details. For example, type of cancer or exact chemotherapeutic agent.